Hi, everyone. Sorry for the brief delay, but thank you so much for waiting and for joining us today. My guest is definitely worth waiting for. I'm Stacy Hurt. I am a HIMSS digital changemaker and senior health advisor at OSP. I would like to welcome you to the third episode of our webinar series, Healthcare Leadership Insights. I am super excited to be joined by my friend and fellow HIMSS changemaker, Dr. Rasu Shrestha, who is the Chief Strategy and Transformation Officer and Executive Vice President at Atrium Health. I have to say a personal comment first. When I became a HIMSS changemaker, one of the first people who reached out to me and championed my voice was Rasu. I am pleased to call him a friend, a mentor, a confidant, and a fellow Pittsburgher with his roots here. We miss you. And Rasu, thank you so much for joining me. And how are you today?
Oh, I'm doing great. Thank you, Stacy. And I'm doing even better now that I'm actually chatting with you. So yeah, really excited. And thank you for those kind words.
Well, I know you get 50,000 invites daily to be on webinars. So I really appreciate you joining me today. And today's topic, we're talking about patient-centricity, which is, we each share a passion for that. And specifically for digital health tools to enhance patient-centricity. And, you've been doing this a long time, several years of experience in medicine and knowledge of healthcare IT. So let's just dive right into the importance of delivering patient-focused care and sharing your in-depth knowledge of these tools. So your background's extensive. You're a radiologist, you have your MBA. Rasu, what motivated you to work in the health technology sector?
Well, thank you, Stacy. Radiologists are surrounded by technology by default. We have scanners, we have all of these technologies, and today we have AI and so much at our disposal. It's interesting how math and physics really factor into radiology in such a strong way. I got trained in informatics way before it was cool for physicians to get into informatics. And given the amount of time radiologists spend in the dark room, you could say that I went from the dark side to the dork side with health IT and informatics. And while I was working in Los Angeles, this is after my informatics training in London. So I was working in Los Angeles. I pursued an MBA at the Marshall School of Business and attempted to hone in on refining the fine blend of medicine and informatics and business into a more patient-centered innovation approach, one that would take the passion that I had right from my childhood days when I was determined for me to be a doctor so I could save a life, I could impact lives in positive ways and scale this, right? So that was my entire goal in blending all of these different interests and capabilities together, and to do this the right way for the industry at large. And so I'm really privileged to be where I am today. And having done this now for 2 to 3 decades, the experience that I have behind me is just testament to the approach that I think we collectively as an industry need to be, doing more of, which is let's make sure that the patient, the person is in the center of all of the innovations, the strategies, the very changes that we're pushing forward with.
Well, like I said, at the top of the hour, as a patient, and I started talking about bringing in, patients and as people into this process. And I wasn't quite sure, is this a thing? Is it not a thing? And, when I heard you amplifying that and backing me up and saying, it is a thing, that's how I knew, that it had real traction and that we're really just starting to go where we need to be,
Exactly.
Which is super exciting. And I love my radiologists. This cancer survivor loves her radiologist after about 50 PET scans. But Rasu, you are doing some really cool things at Atrium Health. Like I said, I miss you here at UPMC in Pittsburgh, where I am, but you are really doing some innovative work at Atrium Health, particularly your adaptations, during COVID-19. I was wondering if you could tell us some of the things you're doing, give us some examples.
Sure. It's really interesting as we are right now today reflecting on the challenges that we've been through as a society in the last year and a half and more. COVID-19 has now killed as many Americans as the 1918 flu has. It's just kind of stark when you think about this. Approximately 675,000 lives that have just been lost as a result of this. And the US population a century ago was just a third of what it is today, meaning the flu has cut a much bigger, more lethal swath across the country. But COVID-19 has done so much to really accentuate the cracks and fault lines that we already knew existed in healthcare. In terms of innovations at Atrium, let me talk about two in particular, and I'll make these different from the ones that I think we normally hear out there in terms of what health systems have been doing, because we've been doing everything from AI-powered chatbots to virtual video visits to amazing things around how we're pushing research forward. I'll talk about two things. One is social impact. Especially given where we are as a nation, given the cracks and fault lines that we saw exposed at a level like nothing before, we've really recommitted ourselves to innovating around more equitable care. And I think that's really important. We launched what we call our community immunity for all, and focused specifically on things like, for example, the vaccine hesitancy task force, because I think that's so important. I mean, we've seen how even today, unlike say a year and a half ago, we're back in the front lines of a battle that we just didn't need to be fighting, not with the vaccines on our side, but there's that level of hesitancy that's out there. So what we're doing is, we're using this task force and really leveraging data and analytics. We've created this COVID-19 vaccine demographic electronic dashboard with a variety of analytics and capabilities that updates it on a very regular basis, stratified by race and ethnicity and age and vaccine location. And we're taking a very data-informed decision approach to prioritize vaccine distribution in communities of the greatest needs. We're taking in the CDC's social vulnerability index and calculating a ranked decision score by community, and using GIS, geographic information system mapping capabilities to hone in on specific zip codes that are underserved. And within a matter of hours and days, we're able to then right size the haves and the have-nots, right? So it's really remarkable how leveraging the power of data and insights, but really focusing in on that end user, that patient, that person that's out in our communities, armed with the data, we're able to send out those roving testing and vaccination units to those areas of greatest need. And the inequity that we're seeing out there in the communities we're serving are able to be addressed in such a short period of time. So that's one example that I thought would be unique, but also really testament to what we need to be doing today.
Well, I love that. I mean, talk about patient centricity. I mean, we can all talk about get vaccinated, we see the hashtag get vaccinated, but that's not so easy, that's not as easily, done as we can say it is. And facing the challenges, the barriers to somebody getting vaccinated, and like you said, really honing in on the data that points to those barriers. And we always talk about this in the patient community, reaching the unreached, right, Rasu? Getting to the people who need help the most and getting the vaccine to where they are. That's amazing. That's just remarkable. I love that, the social impact, because that's really what we're talking about today. And so, you're witnessing, that's just one example, but you're witnessing a constant flow of healthcare technology across the whole medical system. What do you think about what's happening right now? What are your views on that?
Throughout the pandemic, we saw a massive upsurge in how digital health was embraced. We saw virtual care numbers, rise to levels that we'd never seen before. And that's great. You and I've talked about telemedicine, and we're very passionate about, how, this overnight success story that was 30 years in the making. Because, as a radiologist, I can tell you, we've been we've been doing teleradiology for a while, but it was really through the pandemic that we saw this upsurge in the adoption of telemedicine and virtual care. So there's a lot out there in terms of technologies and capabilities. My view to this is that twofold. One is, as it relates to virtual care and telemedicine, it shouldn't be an on and off switch. It shouldn't be, is it in-person care versus virtual care? It should really be a care continuum, right? And really focused in on that patient, focused in on that person. And we need to meet the patient where the patient chooses to meet us, we being health systems like Atrium Health. And that's what we're doing, is we're really building in, interweaving virtual care services directly into the fabric of how we're interacting with our patients and our community members, right from, like I said earlier, AI-powered chatbots to virtual video visits, to even things like procedures and surgeries, where we're not able to do surgeries virtually, not just yet at least, but we can have prehab, virtual prehab and post-hab, and really weaving all of this into the fabric of providing care from an end-to-end continuum perspective. I think that's really important. The second point I wanted to accentuate here in your question is, we see a lot of technologies out there, and I think it's really important to right-size the signal-to-noise ratio. It's not just technology for the sake of technology. We've all seen that cartoon of patient-centered care, where the patient is in the center of that cartoon. On one side, you've got a clinician charting on a computer, and on the other side, you've got another clinician that's looking at his phone, and in the middle is that patient. So the patient technically is in the center, but is he or is she, right? And so how do we make sure that we're able to really focus in on that patient? We're able to make sure that technology doesn't become a barrier to care, it becomes an enabler of better care. So that's my perspective on all of this.
Yeah, well, I couldn't agree more. I love your points about technology just aiding in the continuum of care. I look at it, I think technology in a patient's care continuum, as you said, it should be like a fan when you're going to sleep. It just should be in the background, helping enhance the quality of the sleep. You shouldn't really even know it's there, right? It should just be in the background, making things more seamless or more efficient or whatever, but it shouldn't be, you shouldn't even know it's there. And yeah, certainly to the metaphor you used in the cartoon you talked about, and the patient's stuck in the middle of all this. And I talk to patients every day. It can be really intimidating, that, you have this going on there and it's like, well, what about me? I have a major thing going on,
Exactly.
So no, totally great points. And you've already alluded to some of the things that you're using, Rasu, but can you elaborate more on some of the technologies that you think are really transforming healthcare, and where do you think we are? Where do you think they're going for patients?
Yeah, no, absolutely. Lots of technologies out there. I would specifically pick at AI and blockchain as maybe two technologies or enablers that seem to have a really great PR team behind them.
Yeah, those are the buzz terms. Yeah,
those are the buzzwords. It's everywhere. I do believe that AI has the ability to decipher vast troves of data and generate great insights that could truly augment care. But technology often creates an artificial barrier between the patient and the clinician. So I tell the AI's PR team that AI should not stand for artificial intelligence, but really augmented intelligence. So I'm really excited about how capabilities that we've been honing in on around AI could really augment the care, bring out the most humanistic elements of care, really aid in the human interactions that I as a clinician need to have with patients and their circle of trust. And I think that's really important. So that's a great opportunity. I'm also excited about remote patient monitoring and management. I truly believe that home is where the heart is, and healthcare for decades, centuries at a time, we've just been focused in on more of the traditional care venues, the bricks and mortar facilities. And we're not, moving away from the bricks and mortar facilities completely. In fact, we still break down as human beings. We need, CAT scan, we need surgery, we need to be seen in those bricks and mortar facilities. But I envision those bricks and mortar facilities quickly evolving into, air traffic control centers, where we're really looking out at the homes, the communities that are part of the livelihood, the lives that our patients and our communities are leading. So really remote patient monitoring and management. And then the one other thing I'd say is, on the translational science and the life sciences front, we have so many transformative technologies that we can be proud of too. So here at Atrium Health and Atrium Health Wake Forest Baptist, we're leading the nation in regenerative medicine. Dr. Tony Atala, who's here with us at Atrium, is literally 3D printing organs, Stacy, using the patient's own cells. So cool. Right, it's amazing, right? We're taking the patient's cells, we're actually regenerating the cells, growing it into the patient's kidneys, actually 3D printing it, and we're then able to transplant it back into the patient with no organ rejection because it's their own cells, and it's amazing. So lots and lots of amazing innovations coming out in this space. So while AI and blockchain seem to have a great PR team, I think there are a couple of other transformative technologies that I'm really proud of as well.
Wow. Well, I just have to digress there on the 3D printing, just from my own experience. Just in the time that, we've known each other, I've had a few cancer scares. And I think about the fact that, my surgeon had to weigh in, you can get imaging, as you know, and imaging can get you so far, but until you see the anatomy, you don't necessarily. So I'm wondering, how you can model the anatomy with the patient's cells and monitor those changes without, and minimizing maybe intrusive surgery or something like that,
Yeah,
how neat would that be? And so much you said, and I have to swing back for a minute to, the artificial intelligence thing. I mean, patients are scared of that. I have to just say, there's this perception of this sort of big brother thing, or they know everything that I'm talking about. And we have a big education gap, and, to fill, in terms of artificial intelligence being our friend and not being scary. I love what you said about augmented intelligence. I just, you might see that again after this webinar. I'm just telling you. But anyhow, moving on to our next question, we want to move into sort of the leadership portion of this. You're such a leader for all of us. So how do you think healthcare leaders can evaluate their success in this digital health era? Just from your own experience, what sort of best practices can you share from that, Rasu?
Yeah. So, when you think about translating everything that we're doing in terms of innovation and strategy, I look at it as, what's the impact that we're creating at the other end? Because I think that's really important, the value, the impact, are we really moving the needle or not? And the approach that I've been really championing here at Atrium and across the industry is translating strategy into action with more of a patient-first mentality, right? A consumer-first mentality. And I think that's really important, to focus on the needs of our patients, the consumers, the communities that we serve. And we've seen, amazing things happen through the pandemic, as we established earlier, a surge in demand for, in-home care across the country, the hospital at home programs that we pioneered and championed at Atrium Health. But, at the end of all of this, the winners in healthcare, I believe, must focus on offerings that are desirable, that are accessible, that are affordable, and that are scalable. And I look at it through those metrics, right? So, defining that path forward and making sure that we're able to really get at, yes, a digital first and a connected everywhere sort of a care approach, but really making sure that we're able to focus in on the desirability, the accessibility, the affordability, and the scalability elements to create that impact that I was talking about earlier.
I hope everybody is watching this. Does everybody hear this right now? I'm certainly going to go back and rewatch my own webinar and pull these amazing best practices out. I love that what you're talking about really, Rasu, is outcomes-based measurement, and really what do we want to achieve, and then working back towards the digital technologies to serving that end. And again, that's just so encouraging to hear. I feel the same way. Surprise. But next, I want to talk about, a topic that is just hitting all of us, and that's mental health. We are in such a mental health crisis right now, exacerbated by the pandemic, where we're seeing mental health, all-time lows. And this patient-focused approach is successful for facing, this mental health crisis. So in terms of promoting, again, patient-centric mental health, what kind of health tech innovations do you think can best serve that need or treat that big problem?
Yeah, so there's a lot that we can talk about here. In terms of the patient-centered approach, I always talk about 2 ears and 1 mouth. That's what we're blessed with. I believe that, there really are a lot of things that we need to be doing as senior leaders, but listening and empathizing and then acting on what we've learned, that's really important in addressing, these burning issues like mental health and behavioral health. One specific thing that I'll point to around that as we're, utilizing our 2 ears and 1 mouth sort of an approach around this is, mental health has really been challenged with 2 big things. One, stigma. There's a lot of stigma associated with mental health. And then the other big challenge is access, right? Access to expert resources and expert care around mental health. And again, through the pandemic, the demand for behavioral health, mental health resources has really gone through the roof. And those 2 challenges, however, are still very much out there. We're seeing a lot of things that are buzzworthy in this space. This is Headspace, you might have heard, and Ginger
Sure.
announced a $3 billion merger to combine their respective direct customer and their plan employer offerings into a single platform that'll treat mild to complex behavioral health diagnoses. And this is so much money out there in mental health.
Yeah.
The way that we're approaching this at Atrium Health, one specific way, is really very innovative. It's combining virtual behavioral health and integrating it directly into primary care. It's a unique model that we're really championing here at Atrium Health across the Southeast, and many others across the country are looking at that model. And what that does is we're saying, hey, let's leverage the power of virtual and virtual behavioral health, but integrate it directly into primary care so that we can directly address those 2 big issues of stigma and access that I talked about earlier. And when we have the patient in the primary care clinic, talking to that primary care practitioner, we're able to click a button, virtually beam in the mental health experts. We're not saying, hey, let's schedule another visit, let's, down the line, we're kicking the can down the line. That's not what this is about. This is about leveraging algorithms, this is leveraging technology and virtual, but really bringing in that integrated approach where, again, as a care team, we're in service of that patient. We're working around the patient to address some of the most critical issues around mental health and behavioral health.
Well, I think that's so important because you can't just keep reliving the same thing over and over. You really have to keep building on it. And I think that's where, these health technologies and tools can help. Like you said, pulling out the algorithms and, what is unique to that patient and what is going to aid in their healing, of restoring their mental health, wholeness. And I think that's really where it can most serve, but again, that's probably a whole nother webinar, but anyhow, moving on to, we talked about the data, and the buzz term is the data, and we know how Stacey Hurt feels about the data. Patients own the data. I'm very outspoken about that. It's our data. We need to know where it's being used and how it's being used. But Rasu, I want to get your views on that. How can healthcare providers utilize data and analytical capabilities to ensure patient-centric care? I think that's the key to all of this.
Yeah, absolutely. Yeah. So it's a great question, Stacy. And the way that I've even constructed the strategy and transformation office that I lead here at Atrium is testament to exactly what you're talking about in how we need to approach innovations and strategy, but aligning it to data. So I have the strategy planning group with the innovation group, with our what we call our new ventures group. But I also have, in addition to marketing communications, the specifics of our data and analytics team. And I believe that leveraging the power of data and analytics to drive towards innovative, patient-centered innovations and investments and inventions, that's the way for us to really align our strategic priorities and move the needle in the right direction. There's never been a time like now where we're being challenged, Stacy, in so many different ways. The very fundamentals of science and trust and evidence are being challenged. There's so much misinformation and disinformation out there. And trust, right, is perhaps the most sacred currency out there in healthcare. How we build or regain trust, how we grow and nurture trust is going to be fundamental to differentiating, how we'll come out on the other side as winners or losers. So we have to use data and analytics to drive evidence-based approaches to innovative solutions. But we need to do this in a truly personalized, relatable, and impactful way. And hence that alignment that I've built around the strategy transformation office. I say the antidote to massive distrust in information and privacy is not information blocking, it's open data, it's open APIs, it's more open policies, but it's making sure that we're able to do this with our patients, right? It's the patient's data. What all we're doing is we're taking that data from the EMRs, we're making sure that we're able to then serve it up to our patients, and we want to engage and empower our patients to take charge of their health and well-being and work together as one care team in doing so. So I think there's a lot that we can do to get it right as we move on forward.
Yeah, well, again, it's just good to hear that this is how I feel as a patient. And then when I hear you speak as a physician and a leader of a massive health system, it reassures me that we're in this together. Everything that you just said, nobody, first of all, is integrating each stakeholder better than you are at Atrium Health and some of the work you're doing. And Rasu, everything that you said about trust, when we have that trust, it improves our relationship with our care team. When we know that we can trust you, and you have our backs, that just pushes the healing needle so much further along. It certainly did for me, and it's really disheartening right now to see the lack of trust out there and the misinformation. And, we're fighting to push that border every day. And certainly, just a couple more questions, and then we're going to open it up to questions from our audience. 2 more questions I'm going to fit in. So you already talked about this, but where do you think the future of healthcare is going? What do you think the technologies are going to be the future of healthcare?
Oh gosh, yeah, there are many ways that we can go, right? We talked about AI, we talked about a number of those capabilities. I believe in what we're calling our connected care everywhere strategy, right? The specifics of that, Stacy, is look, care is shifting from the bricks and mortar facilities to where you eat, work, live, and play. And I think that's really important. So the idea behind connected care everywhere is we're broadening our aperture. We're saying, look, yes, patient-centered care is what we're all about, but if we broaden that aperture, it's also about person-centered care. So it's not just about treating a disease, which is really important. We're double downing on that, and we're really pushing the boundaries of everything from, I talked about regenerative medicine to oncology to so many different areas of chronic disease management and such. But it's also about wellness. It's also then about ensuring that we're not just surviving, but we're thriving. We're leading our best life possible, right? So how do we leverage the power of the Internet of Medical Things, the remote patient monitoring and management, the capabilities that we talked about around AI and data to then drive towards more of a patient and a person-centered approach to care through that connected care everywhere strategic framework. And that's what I'm really most passionate about. I see that as the future of healthcare, but it's also something that we're already doing right now. We're just scaling it up. And that's what I'm really excited about in the next couple of years.
I love that, because you said something that really resonated with me, that person-centered healthcare. Because when I was treated, as I went through my cancer journey, my physician always took into account that I was a person first, and specifically a special needs mom, which, we used to have to flex treatment around the needs of my son, and what I couldn't do with him, or my typical son, and being a mom, being a young cancer patient. So I just think, and you can apply that model to any chronic disease or any problem that you're treating, is that patient's a person first. And like you said, going to where they are and connecting with them in the environment that they're functioning in as a person, I think is incredible. I might have to move to Charlotte, but anyhow, yeah, since you left me here, I got to go there. But my last question, which is definitely, a Stacy-like question, got to get it in there, is, Rasu, I think we're doing patient centricity just wrong. I think we're doing it all wrong. And, listening to you today encourages me that we can do it right. But what do you think, just how can we get it right? Why are we doing it wrong? What are we doing wrong? And how can we fix it? Just overall, we usually go out and come in. Let's go in and let's move out a little bit.
Yeah, it's a great question. And I love the challenge that you're putting in front of not just me, but I would say in front of the entire industry here, Stacy. What I'd say to answer to what you're talking about here is, it really isn't about technology. We've talked a lot about technology and the different things that we need to be doing around technology, whether it's AI or blockchain or remote patient monitoring and management, heck, even regenerative medicine and some of the technologies there. There's the triangle of people, process, and technology. This is not a technology challenge. It is a people and process challenge. If we get these right, the right technology will really blaze the trail forward. I think we need to embrace the principles of design thinking. I've been saying this for the longest time, where we're empathizing. You lead first with empathy. You're sitting down, we're listening to our patients. We're sitting down with our end users. And then what we're doing is we're iterating and we're experimenting and we're building on those successes. We're learning from our failures, but we're moving on a very iterative manner and then designing the right elements with that end user in mind. And it's that process that I think is really important for us as well. And engaging the right stakeholders early and often through that process is really critical. So we talk a good game when we say patient-centered care. It just rolls off our tongues, but at the end of the day, it really is about us rethinking that entire paradigm in terms of people, process, and technology. Technology is not the challenge here. It really is about people and the process that we need to embrace.
I couldn't agree more. So let's catch our breath here. I am going to go check out. We have a very robust chat going on here, Dr. Shrestha, and I am excited. I'm not good at the chat, so bear with me. So let me go right up to the top here. And okay, so I'm just going to take some questions here. Okay, so where do you see, and you kind of touched on this, Rasu, but where do you see digital health fitting into preventive medicine? we've talked a lot about, some acute problems and whatnot, but where do you see it fitting into preventive medicine?
Yeah, that's a great question. And, my approach to broadening that aperture, as I described earlier, from patient-centered to person-centered care, really takes into account, obviously, the sick care elements, right? Healthcare has been about sick care, not really health or care. It's really been focused on getting better from illnesses. So that's important. We're going to double down on that. We're going to do it right. Then there is that, outside of that circle is wellness and preventative care. And I think that's really important. It's making sure that we're able to risk stratify our patient populations, leverage the power of data and insights. We're approaching population health to say, hey, what are the best practices for that NF1 as we're looking at the NF many, right? So congestive heart failure, COPD, and then we're putting in the preventative measures in place across populations of patients, but for that NF1. And then beyond that really is what we talked about earlier in terms of thriving, right? Leading your best life possible. And that's beyond sort of the wellness to saying, all right, what are your wants and your desires? What are some of the challenges and opportunities that exist in the socioeconomic status that you're a part of, the work that you do, the busy mom that you are with the challenges that you have in your families, and really taking into account the specifics of your wants and your desires and your dreams, and building that into the health and wellness journey for that patient and that family. And that's what this journey should really be about.
Gosh, I love that so much. I'm hoping that we can, as we start improving digital health literacy more and educating more on all these things to the population at large, what I'm hoping is, could you imagine, Rasu, if like we plug into an app like our risk factors and our family history, and again, it can predict, again, through AI, et cetera, it could predict what we're at risk for and head it off at the pass. I had no family history. I wish I would have known there must have been some genetic risk factor out there for colorectal cancer. Could you imagine if I could have, through the power of technology? Oh man.
Absolutely. Exactly right.
We're doing it.
We are.
Next question is, have you been able to look at physician coverage models based on geographic COVID vaccinations, cases, or other social determinants as part of the care continuum? Timely access, in other words, does access to a physician impact care perceptions? Wow.
Well, that's a great question. Thank you, Richard, for asking that question. And so the short answer is yes. This is exactly what we've been doing, leveraging our data and analytics capabilities and really honing in on that level that you're talking about here around the physician coverage models and the geographical elements of what we're trying to balance, right? From the social determinants piece to the access issues that you're talking about here. When I talk about us really double downing on our social impact strategy, those are the types of things that we're actually looking at. And how do we then interweave the elements of, care and care venues, even as we're geo-mapping out specific care venues, to other ways that we can really address those vacuums in a more agile way, right? So leveraging the power of our mobile clinics and mobile vans, but also virtual care and making sure that we're able to really address some of those gaps that Richard was asking about in a much more agile and nimble way. So yeah, really important question.
Yeah, for sure. Let's see. I like this one. I'm a little biased to this one. How can we give patients back their data in a compliant and patient-centric way? I just, before you, as you're gathering your thoughts, Rasu, this is the big thing with patients is, how do we balance privacy, and protecting privacy and having full access to our data across all the stakeholders so that we can all work together, but still maintain a certain respect for HIPAA. I know that, in my advocacy work, when a patient's back is against the wall, privacy goes out the window, when it's a life or death situation. But the flip side of that is having great respect for people facing an illness the way they want to, but yet having the most data possible. So what are your thoughts on that?
It's a great question. I do believe that the data does belong to the patient, right? And all we're doing is curating and hanging on to the data in service of our patients. You know, I mentioned earlier the antidote to the massive distrust in information and privacy concerns is not information blocking. And there's a good amount of debate going on in the industry about information blocking, whether it's with larger EMR vendors or with health systems and even physician practices that are just, you know, blocking information and not giving access to patients their own data. You know, so the antidote is not that. The antidote is really open data. It's open APIs and open policies, like I said earlier. And I believe that what needs to happen really is, you know, even if I reflect back on the last couple of decades of the challenges of interoperability, you know, we've been depending so much, Stacey, on our EMR vendors to interoperate amongst each other. And the business models prevent the level of interoperability that we really need. I believe the future of interoperability is where, you know, we actually free the data and give the patient the charge of their data in a very controlled, secure environment, and do it in such a way that we're able to really empower the patient to work with their you know, trusted clinical partners and do stuff with their data. So if they wanted a second opinion, they have access to their data. If they wanted to, sign up for a research protocol, they have access to their data, right? And I think that's how we really push for true interoperability forward, through open data, open APIs, and open policies, but really with the patient in the center of that equation.
I mean, again, I couldn't agree more. And I would love, because I mean, you know, all my nightmare stories of all of my, you know, different tests across different, and like you said, it's, as patients, we've always kind of pushed that responsibility to the EMR vendors, when in fact, again, if we flip the script and we change the model to it being with me and I move around, you know, and I own my data, I think that's truly the answer. How do we get to do that? We'll do that tomorrow. Not a problem, Rasu. We're gonna do that tomorrow. I'm going to take a question from a friend of mine, Laureen Brown over at Medosity, who asks, any suggestions on how best to make healthcare more affordable and accessible through technology? Wow, I love that. How are we going to do that?
Yeah, that's a great question. I wish I had the silver bullet right now with me. I don't have that silver bullet, to be very honest, but I think how we make it more affordable and accessible is first and foremost by really addressing the complexities that exist in healthcare. We are a really complex industry. You know, healthcare is hard. It is really hard for caregivers like you, Stacey. It is hard for patients like you and others that are out there. But it is also hard for clinicians that are going through burnout. It's hard for health systems like us. It's hard for health tech companies that are coming in to solve for the challenges of healthcare. Healthcare is hard, but we don't need to make it harder. Right? What we're doing in the United States in the delivery of healthcare is we're making it harder. We're miring the complexity with even more complexity, whether it's in terms of the ICD-10, the billing codes, nothing against those codes in per se, but what we have are we've got lots and lots of middlemen in the delivery of care. Right, provider organizations and physician groups and independent physicians interacting with payers, interacting with, you know, vendors and such. There's lots and lots of middlemen, and in that process, costs magically tend to escalate. Complexity magically tends to multiply, and I think it's really important for us to, you know, take a step back and really critically look at all of the middlemen that exist. And really figure out, look, what does it mean for us to move towards value-based care? How do we really bring together the payers and providers in a much more aligned way so that we're aligning our incentives based specifically on the wants and desires and outcomes of that patient? And I think if we're able to do that, then we can start right-sizing the complexity that we have out there. And what that will do is we'll start seeing costs start to come down and access start to increase, because that will right-size the way that care needs to be delivered anyway. It's a complex answer to a really complex question. I don't have the silver bullet, but I think that's the trajectory that that bullet needs to be shot at.
Yes. I wanted to ask you a question, Rasu. Can you see the chat? And
Yeah.
I always, you know, I always talk about patient centricity, but on any webinars I do, I'm also guest centric. So I want you to please, if you do see the chat, if there's a question that you particularly want to answer, please jump in because there's so much here. But I'm just wondering, as you're looking, if anything has caught your interest that you'd like to speak on, Rasu.
Yeah. So wow, this chat is blowing up.
I know. That's why I needed some help.
Great, wonderful. So let me maybe focus in on this one question from Pamela. It says, "Hi, Stacy and Rasu. My concern is that in health systems we see patient-centric as ways to make things easier for the provider, to offload work and burden to the patient. That we too often look to digital to fix the overwhelming burden in physician offices rather than look at the full experience." So it's a great statement and a question from Pamela, and I don't disagree with Pamela. What I'd say is that at least in the approach that we're taking at Atrium, the approaches that I'm pushing forward both here in our system and across the industry, it is not a means to offload the burdens, the challenges that clinicians are already facing onto the patient, but it is two things. One is that we need to work more collaboratively together as one team. And it's that team-based approach that we've been talking about for the longest time that really needs to be actuated by aligning those incentives that I just mentioned earlier. So that is one core approach. And then the other thing, and Pamela mentioned this right at the end of her question, is around experience. I abjectly believe that the core focus for us really needs to be where we're elevating ourselves from the transactional layers of healthcare to the experiential layers of healthcare. We've been mired with the complexities of transactions. And I think it's offensive to patients when we distill it down to billing transactions and handoffs and all of that. It's about the experience, right? So how do we really elevate ourselves to understanding that experience and really accentuating the best experiences at all possible for these challenging times that these patients are going through when they interact with the health system?
That was phenomenal. I see one I'm going to ask you because I want to just pick your brain on this real fast. And this is true. This is from David to everyone. EMRs are not patient or physician friendly and are inefficient for all providers and frequently contain incorrect data or missing important data, especially subjective assessments of people as opposed to medical patient data. I just want to take this out a little bit. And what do you think, Rasu? How are we going to fix EMRs? I mean, it's kind of a mess, let's be honest. I mean, physicians are really burned out by more and more that's being asked of them within EMRs. What do you see as maybe some solutions EMR, or what do you think can help this EMR problem?
So it's a big question, and I love the question. So here's the premise, right? Clinicians reside essentially in the EMR, and we're doing everything based on the EMR because that is the system of record. It is how we bill for the care that we provide. It is how we document legally the interactions that we've had, and we create the care plans, we create the radiology reports, the surgical summaries, the discharge summaries, and all of that. So clinicians live in the EMR. Patients don't live in the EMR. They live above those silos. They live in the real world where they eat, work, live, and play. And patients at best maybe are interacting with a portal, with a computer screen, a tablet, maybe devices that they wear, a smartphone that they may have. So that divide between where clinicians typically reside and where patients typically reside needs to be bridged. And that's what we're intentionally doing here at Atrium. We invested in a platform called Zealth that really allows for us to seamlessly connect those two divides, where much like how today in the EMR, A physician can prescribe a medication and they'll say, hey, Stacy, what's the closest pharmacy that is convenient to you? And that medication appears at CVS or the Walgreens or the Giant Eagles in Pittsburgh, right? And what we're able to do is similarly in the EMR, we can prescribe digital therapeutics. We can prescribe apps that magically then securely appear on your smartphone or your device, and creates more of a bidirectional interface between the clinician's world, the EMR, as well as the patient's world where they eat, work, live, and play. That is a stab in the right direction, but we absolutely need to, in the spirit of how we do things in Pittsburgh, bridge the two divides and move in that direction.
All right, I love it. I love it. I'm going to just wrap this up with one more question, just because we could, like you said, it's a robust chat here. And this is sort of a take on somebody's question, but we talk a lot about, ROI and demonstrable ROI. And this is where I get really upset, because I always talk about education and, health literacy and educating patients, and that does not have perceived ROI. So how do I tee this up? How do you think we can show the value of return on investment for educating patients, which comes back to patient centricity, on how to use the digital tools? How can we demonstrate how important that is to using these digital tools? I mean, that's where true patient centricity is. If a patient doesn't understand how to use these tools, they're not going to use it. And how do we get people to understand that that's where it is? That's where it's at.
Yeah, and it's a really good question, Stacy. And what I'd say is, look, if we're not working hand in hand with our patients, whether it's in not just educating our patients, but really, I said earlier, we got to listen and empathize and connect with our patients in really unique ways. Because oftentimes it's not just the questions that the patients have, it's also the questions that are unasked, right? What's being said that really isn't being said. And I think that's really important. And so when we listen and we empathize and we're able to connect in those unique ways, then the education element follows naturally. And I think that's really important. But it's those conversations, it's building that trust. And it's through those educational modules, those interactions that we have, the trust building that we need to be putting in place, that we really then get to those outcomes. So when we talk about value-based care, one of the core elements of what defines value is outcomes. But outcomes don't magically happen. Outcomes happen as a result of these things that we're actually talking about: the education, the interactions, the trust building, the communications that need to happen. And I think we need to quantify and add value to those elements that then contribute to those outcomes. And I think if we do it in that manner, then we're actually then incentivizing the right outcomes, but also showing a glide path towards how we actually get at those outcomes in the first place.
Well, like I said, I am going to be re-listening to my own webinar, because there was so much richness in here today. Rasu, this has been just the honor of my life that you would join me today. And I thank you for all you do. Again, I am just blessed to call you a friend and a mentor, a leader, and definitely somebody who's championing my voice. I can't thank you enough. Audience, if you're out there and you are not following Rasu on Twitter, you are missing out. I just nominated him for the most wise voice on Twitter, but you definitely need to follow Rasu and just to know the great work also that he's doing at Atrium Health, which is just trailblazing and visionary what he's doing down there. And he absolutely defines transformation. So Rasu, thank you so much. To everybody who's joined us today, please visit osplabs.com to learn more about what we're doing to help transform the industry and discover custom healthcare IT solutions if you need them. We here at OSP Labs are here to help you. So please let us know how we can do that. Rasu, thank you so much again. It's been a true pleasure.
Thank you. Thank you,
And
Stacy. Yeah, I really appreciate the conversation we had today, the amazing engagement that we had from our live audience. And let's keep the conversation going, like you said, both on social media and in real life. This is real. I mean, this is the opportunity of a lifetime for us to really transform. And transformation shouldn't be a buzzword. It should be the reality of what it is that we actually do. So thank you, Stacy.
absolutely. If we're not going to do it now, we're never going to do it. And it's a shame it took a global pandemic to make it happen, but we are boots on the ground making it happen. And we hope that you're with us all too. So everybody, thank you so much for joining us today. And we look forward to continuing the dialogue, as my friend just said. Have a great day. Stay healthy, stay well. Bye-bye.
See you all. Bye-bye.
Bye.